Make sure they're nice and fit with
Yeah.
no tears
Yeah.
or no stain.
Mm-hmm. So you fit comfortably in the large gloves,
Yes,
right?
I don't think I
Okay.
dried my hand all the way.
Okay.
I think I could have dried them a little bit better. They would have came on.
Came up. Okay.
But I think extra large would be a little bit loose. Okay, after I get my hands on, I'm going to gather up what I need to get Miss Jamie. I've checked the MAR
Mm-hmm.
to find out what she needed, and she needs on a clean area
Yes.
that's nice and level, alcohol swab and the pain patch. The alcohol swabs to wipe off the arm after I take the other patch off.
And then she's gonna also do a nasal spray. There you go. That's your nasal
Okay.
spray. You need an ear. Nasal ear.
That's tears.
Dry
that's all right.
eye. Okay. One of them should say ears.
Nasal. Nope, ears.
Nasal. So if nasal. What happened to the ear one?
Let's just go make.
You know what? We're gonna pretend one of them should be a
Okay, this is the airdrop.
so we will pretend just use one of them as the
She's gonna need.
so you need the eye drop and the we do have the eye drop. Okay.
You
So
said eardrop. I thought.
ear. Lord have
This
mercy.
is eardrop.
That's the eardrop. Okay. And that's your nasal. All right. And then what else would you need? Okay. So the transdermal, your patch is what you got, right?
Yes.
That's your band-aid. And so the topical, we're gonna use a cream for topical. One of these should work. The cream, your healthy fitting.
healthy
All
fitting.
right.
Something to put it on with.
Yes. Yes.
I'll get it out with.
Yeah.
Well, it wants to be hard to it.
And also, I will have you demonstrate how to give the vaginal. I have the vaginal.
Oh, okay. That one's mine too.
No, but
Oh, okay,
I will
that's
have
fine.
you do the
Okay,
vaginal.
that's fine.
We're gonna pretend with one of these as the suppository.
Okay.
This will be the suppository. So we're gonna take one for us when you are ready, and then we'll do the vaginal. We have a lubricant here that you will need. You take one, and we'll demonstrate it with this one here.
Okay.
So we prepare all your stuff here. Ready.
Okay.
All right.
If I had a napkin or something, I would put the clean stuff on a napkin.
Right. Your pretend napkin is right here for you. So all these are ready on your medication card.
I've already checked my MRI, checked the person that I'm giving it to. I'm going to start off with the pain patch. Hi, Miss Jamie. I'm Tina, your med tech. I'm coming to give you your medicine today. I'm going to do your patch first. Are you okay with that? Are you?
I'm okay with that.
Okay. First, you would take off the one that she had.
That's right.
If there's any residue up under it, you would wipe it off.
Okay.
Disregard of the old patch. And you would put the new patch on in a different area.
Yes.
You would put half of it on. Hold on.
Yes. You can use it.
You would put the first half on first. It makes it easier to pull that little tab off the other half.
Yes.
And then she's good to go with that one.
All right. Now remember, before you put it on her, you want to put your date, your
Oh, yeah, the date
initial,
and time on the patch.
and the time.
Yes.
Your initial,
Date,
the
I
date,
forgot that one.
and the time. So that the next person that comes know when it was what put on there. All right.
Are you sure my name? I'm Jamie.
You told me not to get you back.
Okay.
Miss Jamie, let me see your your name. I've already checked it, your picture and your name in the MAR. But thank you.
Okay, so that was the transdermal patch done. All right, we come to the topical.
Okay, and you have a tropical that needs to go on your
On your feet.
yeah.
You gonna put that on me for real?
You're gonna
Miss Jamie,
you're gonna
it's Tina
pretend.
again. I have your tropical cream for your feet to help with the crustiness.
Okay.
I'm going to put the cream onto the
Yeah,
got the
just
top
like
on
what
it.
you said.
Yeah, just
You
pretend.
sure
you don't need no more straws. Put the cream on. You can either put it onto the tissue to make it an easier process. So, go ahead and put the top on while my hands are nice and clean.
Okay.
I beg your pardon.
Hold on, Miss Jamie. I got you. I'm going to take care of it. Okay. Rubbing the cream all over her feet.
All right.
How's that feel, Miss Jamie?
Wonderful. A little massage would help too, but I'm good.
If I need to rub it a little bit more, I will. Because I'm here to make sure that you feel good.
That's right.
Thank you. I appreciate you.
Thank you, Miss Jamie.
All right.
And what else do you need today? You need some eardrops.
Yep.
Get you some eardrops. Since you're already setting up, we'll do it setting up if you're nice and comfortable that way. Okay. Yes, ma'am. I'm going to have you tilt your head just a little bit. You got to be still, Miss Jamie. We'll make sure it gets in your ear. You're going to pull the top of your ear up and out.
Right.
Because the canal is
Yes.
an S shape, and you want to make sure it goes down.
Okay.
And the MAR, it said 2 drops,
Okay.
only in the left ear.
Yes.
Once it gets in there, I always try to push it like this just to make sure that it doesn't come out. And let her stay there for a moment, and hold the rag for when she comes up. And lift her head. You gotta stay there for a moment though. Make sure it gets all the way down. Okay, Miss Jamie, you can go ahead and lift your head.
All right.
You see with your tissue?
Yes, I
You don't have anything on here?
No.
Okay.
Good job.
Okay, Miss Jamie, you also have a nasal spray that you have to take. This section is your inhaler, ma'am. The nasal spray is on the end. You're going to pump it, and it's going to come into the tube. You're going to put this around your mouth. Take you a nice breath in. Go ahead, Miss Jamie.
I thought you said a nose.
No, this is inhaler.
Oh, okay.
Yes, this is an inhaler, ma'am. This is for
Okay.
your asthma.
Okay.
Help you breathe better. Open up your airway.
Jesus. Okay.
Okay. All right. Thank you, Miss Jamie.
You're welcome.
Are you think you're able to hold this? And
I think so.
okay, we'll put it in your mouth in one spray. Breathe in,
This is the
hold
nasal
the
one.
tip. Oh, the nasal one?
Yes.
I thought you said inhaler. Okay. Hold on
See,
one
they
second.
have the oral inhalant and they have the nasal
Okay, yeah,
inhalant.
that's fine.
Yeah.
I'm ready already.
So you did the oral one. You did the oral inhalant. Now she's going to do the nasal
No
inhalant.
problem at all. Miss Jamie, tilt your head back a little bit. I'm going to spray 2 sprays of each side of your nostril, okay? I'm going to put this napkin right here so none of it rolls down. Okay, spray, spray. You okay? Okay, I'm going to try to go to the other side. Spray, spray. Are you still okay, Miss Jamie?
You got to sniff it in.
All right. Lift your head up, Miss Jamie. Here's the tissue in case you have any drainage. Thank you, Miss Jamie.
So you can hold your head up for a little bit. You tell her to hold up a little bit.
A little bit longer.
And then sniff it in. There we go. Good job, Mama. You got it in.
Okay.
So you're gonna clean the tips of the stuff before you put it back in the med card
Clean,
with your alcohol prep.
clean.
Clean everything all right before you put it back.
it with this one.
Okay. Now we're going to do the vaginal medication.
Yes, ma'am. Miss Jamie, get all comfortable. I've got to give you your vaginal suppository. Well, Miss Jamie, it'll only take a second. You got to get it done. Okay, Miss Jamie? Okay, well, I'm going to have to call somebody if you're not going to do it, Miss Jamie.
So for
Don't you want to go ahead and just get it over with so you can have lunch today?
so for the topical application, we have the
Okay,
sometimes it's
so
a
doing
cream.
suppository.
Yeah, we will do the cream. Let's do the
that?
cream one.
Okay.
Yeah, instead of this one. So
Okay.
we pretend she's going to get a cream for a yeast infection.
Okay. All right, Miss Jamie. We're going to help with that yeast infection.
Yes.
It'll help you to where you're not itching at all. It'll
Yes.
make you feel better.
Yes. Miss Jamie is itching terribly. And the doctor has prescribed. The doctor has prescribed.
The doctor has prescribed this for you. Ma'am.
Yes.
And it will not be bad. Just lay back. I'm gonna put something on it that helps it go in easier. And it only takes a second. I lubricate the top of the tip.
Yes.
Push it down into it. This
Take-
right here is normally out.
Yeah. Tell her to take a deep breath when
So
you
take a
push.
deep breath first.
Yeah, when you push
Okay,
it.
Miss Jamie. Miss Jamie, take a deep breath. I'm gonna go ahead and put it in. Push it all
Scoot it
in.
in.
Get the cream time to get in.
Right.
Miss Jamie, you're gonna have to lay there for about 10 minutes.
Okay.
Okay? We're not wiping anything off there, right?
If the gel is too much, you can definitely use the tissue that you have.
And this will
Some
always
of the
be
tissue.
okay. And this will always be hers, so we're gonna wash it.
Yes, we wipe it clean or wash it and then put it back in the packet that it came with for her, because it's going to be solely for her. Yeah, sometimes we have to reuse them.
Especially if it's a yeast
Yeah.
infection.
Oh no, you use the same one for 3 days.
Uh-uh.
Yeah, you do.
In the nursing home, most of the applicators, we have to reuse them. So we
But
wash
you gotta
them.
wash it,
Yes,
yeah.
we wash them.
With soap
And then we put
water.
it back. Yeah,
Yeah.
we put it back. All right.
I
Okay,
can take
so,
this or take my gloves off.
okay, now you take your gloves off.
Okay, the first one I'm going to pull off, put it in this hand.
All right.
Then I'm gonna take 2 fingers, or one, get it off like that,
Okay.
and throw it away.
All right. Now do the alcohol rub for me to see.
Okay.
It's right there.
Get a good palmful. Rub it in between your fingers, your wrist.
All right.
Kind of a fast rub till it dries.
Mm-hmm.
That one smells decent.
Okay,
And
dokie.
that's about right.
All right. So you put all your stuff away.
Yes, ma'am.
You clean the med card for the next shift. Because we're not leaving any mess for anybody to come and clean after us.
Yes, ma'am.
Already. Thank you very much.